Andy Egbert with APM Research Lab based out of St. Paul, Minnesota. Thanks for joining me today. So we were going to talk about how COVID is affecting primarily people of color in the US and in Minnesota. But based off of your data, how are people of color adversely affected by COVID?
We know this answer to this question because at the research lab, we have been monitoring deaths from COVID by race and ethnicity for all groups since early April. And so we have been analyzing that and assessing the national picture. What we know from our very latest update in our project called Color of Coronavirus is that after we adjust for age differences in the populations, Black, Latino, Indigenous, and even Pacific Islander Americans are dying at roughly 3 times the rate of white Americans from COVID. Well, all of our lives have been affected in some manner from this. The toll on populations of color has been far, far greater.
And how has that trend changed over time in Minnesota specifically?
Well, we see nationally that unfortunately things have worsened over time. We're seeing a pulling apart, greater inequality in the mortality rate. And here in Minnesota, we see that particularly for 2 groups, between Blacks and whites in Minnesota and our Indigenous population and whites. We see widening inequalities in the rate at which they are dying. That's over the summer and into the early fall here.
Are there factors that are influencing those kind of disparities?
We know that there are exposures that are higher in the workplace. We know that populations of color are more likely to be having those exposures due to many historical factors. They may have poorer health status to begin with. They're less likely perhaps to receive timely testing or quality care. They may be more likely to wait till advanced stages of being ill, perhaps less access to sick days, likelihood of going to work sick for that kind of economic imperative of needing to put food on the table. The whole kind of host of differences and inequalities that we see in society are kind of in a reflecting pond here with COVID. So all the other inequities that we call systemic racism, all the other ways that populations of color do not have the same opportunities as our white population, we see kind of coming home to roost in the data for different and worse outcomes for COVID.
That kind of speaks to the data trends that I've been seeing when it comes to COVID, that these disparities between people of color and white Americans have always existed, have persisted, but COVID seems to be shining a spotlight or in some cases making these worse. Is that kind of what you're speaking to with the data trends that you're seeing?
I think that we have a sense of exceptionalism in Minnesota, especially when it comes to health. But when it comes to health disparities, we have the same reckoning to do with how our populations of color are faring. I think as we work to create more equity, we have to think about protections in the workplace, timely testing, excellent health care for affected populations, especially those who might not have health insurance or might not have had good interactions with the healthcare system previously. But again, I want to underscore those are health responses, and what we're seeing in the health data is reflective of society. In fact, many of the other consequences of COVID and how it's transforming our society are threatening to widen those very inequities as people are growing increasingly food insecure, as educational gaps are widening among children, as people are in danger of losing their homes. And so those are the very conditions that create inequities that show up in health disparities. And so we need to, as Minnesotans, think about how we're responding broadly to creating equity and opportunity for all our populations here in the state.
Well, Ms. Egbert, thank you for joining us, and we'll be looking at the Color of COVID research and as well as other research that APM's Research Lab is doing out of Minnesota. Thank you.
Thank you so much.